Hi, Maggie. Let me introduce myself to you. Thanks for waiting for me. I know you saw it was Dr. Sauerwein you saw today, right? Yeah, he's your doc. He's such a great doctor. Anyway, he mentioned that he invited you to start coming to our pain and quality of life class, and he wanted me to introduce you to the Bullseye Plan that we use in the class so that you're kind of oriented to it. And so that's what I had in mind to do. But let me kind of explain my role and what I do in general around the clinic. So I'm a behavioral health consultant, and my job is to help people address stress, problems of living, health challenges, and certainly chronic back pain is a big health challenge, and a lot of people have it, and it can make life very difficult. So today I'm just gonna get to know you just a teeny bit because I want to know a little bit about your life, so I'm better able to work with you in the class, and then I'll introduce the Bullseye Plan. And um, I think when you join the class, you'll be like, okay, you start to feel a part of the group right away. So, yep, I chart the medical record, share things with the team. This Bullseye Plan is something that everybody can support you on. This Bullseye Plan, they'll see what kind of work you're doing in the class, or maybe when you have a visit with Dr. Sauerwein, you'll do more work on this. And so it's kind of a living document that can help you kind of monitor your quality of life and your ability to live the kind of life you want to live, even with the problem of ongoing pain. Does that make sense?
Yeah, it does. I am having quite a bit of pain this afternoon, so I'm just hoping, it's not gonna take too long.
Okay. No, no, thanks for letting me know. And we won't take too long. So just to know a little bit about you, do you live alone with others?
Oh, I live with my husband.
Okay, married for a while?
Yeah, we've been married a little over 10 years.
Uh-huh.
Mhm.
Children?
Yeah, a couple kids. They don't live at home anymore, but yeah, we have a couple kids.
Good. All right. And everybody's getting along okay.
Yeah, normal sort of angst of being 20, the kids. But yeah, we all find our way.
Yeah. And how about work? Are you working or have you pulled back?
I'm trying to work. I'm having so much pain. I'm right now I'm on short-term disability and I'm trying to decide if I'm gonna apply for long-term disability. So, I'm a little stressed out about all that right now.
Sure. Sure. Okay. What did you do for work? Just curious.
Well, I worked at the library.
You like that?
Yeah, yeah, I really loved it. I loved, when the kids came in and, helping people find what they, feel excited about. So, yeah, I miss it a lot, but, it was a lot of bending and stooping and, lifting and, that's just been really, really hard on my back these days.
Yeah, yeah. Well, thanks for sharing that with me. Just a few more questions. The Curious about your hobbies, what you do for fun.
Yeah, I love to take walks in the forest with my dog. Been trying to keep that up. It's been a little bit hard. I used to really like to play pickleball, but that's been a little bit hard. Um, I recently took a knitting class, which was fun, but it's kind of a lot of sitting. But yeah, I have interest, but the back pain just keeps getting in the way.
Yeah, yeah. 'Cause it can be very limiting. Sitting, standing, walking. Yeah, yeah. Requires a lot of skills to work with it, and that's part of what we cover in the class. And trying to get on top of it really requires super skills in many ways. Uh,
Yeah. Not
yeah,
really, I'm not really excited about the class, just to be honest. I'm kind of doing it because my doctor asked me to, but yeah. Anyway.
yeah. Well, I think a lot of people feel that way about the class at the beginning. And of course, it's something new and you don't really know what it's going to be like. But it is an opportunity to learn, just like, if you had something else come up in your life that you didn't really know that much about. The more you can learn about it, the more skillful you can be uh, with working with it. So maybe just think about it as an opportunity to learn. The other thing that sometimes people like is to meet other people and kind of hear how they're meeting this challenge. Does that make sense?
Yeah. Yeah. And, I think of myself as a pretty, courageous person or willing to try new things. So yeah, I'm willing for sure.
Awesome. Okay. Well, that being said, let's go to the Bullseye Plan so you know about it. It's a way of kind of organizing and clarifying where you want to go in your life. Something like chronic pain can make us feel like life is just kind of closing down or closing in on us and kind of um, rob us of our vision of what we want and what we want to create and who we want to be in the world. So we use this image of a target um, to help us kind of create a target for making choices. Because pain is the kind of thing that, the choices we make tend to be like pull back, try to control it, manage it, wait. And meanwhile, life is just happening,
Mhm.
not rolling out the way we, the human, intended that, but more just according to pain, kind of the boss in the body, what it's saying. So we think of the bullseye, that center of the target, as kind of your values are your principles, what's important to you right here, right now, that you want to put your attention on. So values very different from goals. Goals are things we say we're going to do. They're specific, they're measurable. We can go out and do them. The goals are very helpful, and the Bullseye Plan involves goals, but values are different. Values are those global, abstract kinds of things that, really connect with us as humans. I heard a while ago when you said, I'm pretty courageous. I like to think of myself as courageous. That was the word you used, right?
Mhm.
Yeah. Yeah.
And not these days, but I used to think of myself like that. So
Okay. Well, that's what we're talking about. So maybe that is an important kind of direction, is to wake up that sense of courage and bravery and strength um, that, well, if you had it once, you probably still have it because that's a quality, and it's a matter of, you know, getting it more alive by talking about it like we're talking about it right now. Maybe remembering sometimes when you did courageous things.
yeah, I think it kind of makes me sad sometimes when I think about it, like how courageous I used to be and how I'm not really anymore. So sometimes I can feel myself like trying not to think about it. But
Yeah.
yeah.
it- it's like courage is there, and so is sadness about um not having more access to that kind of courage right now and having something like this back pain get in the way.
Mhm. I like that you say it still lives in me, even though maybe I don't see it as much as I used to. It makes me feel a little better, like maybe it's still there.
Can you just recall a time when you did something courageous, even though it was very difficult and maybe you felt sad?
Well, I can remember a time when I was in college and everybody was going skiing, downhill skiing, and I didn't know how to do it. And I was a little bit scared, but I wanted to go with all my friends, and so I just strapped the skis on and I did it. And I was scared, but I ended up having a lot of fun. And I wasn't very good, but it felt good to just to have done it.
I see courage in your face right now.
Yes, it feels good. Like I said, it's kind of mixed, it feels good and sad. Like sometimes I try to avoid feeling sad, so I don't think of those times, but feels
Mm.
good to say it out loud.
That is very useful. I think we kind of, you know, uh, hear people say it's not good to be sad, but sad usually just means that something's really important,
Yeah. Hmm.
really important. So when you feel it, that's a good time to kind of touch your heart and say, bullseye, courage.
Mm. Mm. Let's try that. Bullseye courage. Feels a little silly.
Yeah,
Yeah.
with it.
Mhm. Yeah.
The silly's a judgment.
Hmm.
And what does your heart say about bullseye, courage? Yes, I am. Yes, I can. I want that.
I think it says like you can do it.
I'm going to make some notes on your bullseye plan. I can do it. Mhm. Yeah. And I'm going to just make a little note about downhill skiing for the first time. Scared and courageous.
Hmm.
So we're probably not going to, in the class, get you out to go downhill skiing. Yeah, that would be silly for sure.
Yeah. Yeah.
Uh, but we're gonna see what that courage feels like more. We're gonna talk about it more. And we're gonna, I think between now and the start of the class, just for you to start to tune into whenever you do anything just a little courageous.
Yeah, it feels courageous being willing to talk to you today because I didn't want to do that.
Yeah,
So
big,
that,
big courage move. Okay. Well, maybe I'm going to give you a copy of this bullseye plan. Just you can put it on the refrigerator. You can fold it and put it in your purse. I like to let people know what I'm working on in my life, and if I feel like they're going to be on my team. It sounds like your partner is on your team, right?
yeah, yeah. No, he'll be really glad that I talked to you. He's always suggesting that I talk to somebody about this kind of stuff. So,
It's very hard to have chronic pain and live your life the way you want to. So
yeah.
there's a lot to it. Um, anyway, he probably could do his own bullseye work.
Oh yeah. Oh yeah.
Yeah, so inspiring others by being transparent about it, I think is pretty cool. Anyway, maybe make some notes. If you have a courage check every day or two, write down a note about what I did that was courageous. Because I think the first step is to really grow that sense of
Mm.
that bullseye, make it really visible. Because I think pain can kind of like take our vision away from it, and if we
Yeah.
can't see it, we can't feel it, and we can't kind of make choices in,
Mhm.
in our behavior that kind of get us on the target, which is what the group's about, is kind of like where am I now? Am I getting close to the target in some ways? What else could I do? So I think the first step here that makes sense, Maggie, is just make some notes about when you feel a little bit of that, to get that feeling alive.
Mhm. I think I can do that. I think I'll
Okay.
maybe I'll set a little reminder up on my phone, just to maybe remind me to check in on my courage meter.
That sounds wonderful. Yeah. What's that courage meter like? Yeah. So on a scale 1 to 10, gonna do it? Set that notice on your phone.
Yeah, I think like 8.5, 9. Like I think I'm gonna do it when we get off the call today. I think I'm gonna go ahead and just do it.
Okay. I like it. I like it. Nothing like now.
Yeah.
So you have all of the information. The nurse gave you all the information about the class and everything. And I just want you to know anytime you want to have a one-to-one check-in with me about the things, the skills that you're learning in the class, just to go in a little bit more in depth about something or have a question about something, I am available. And we could set up a little check-in one-on-one before or after the class that you attend. Other time, sometimes people just come to the class and continue to learn and expand. But other people drop in, so we'll see how it goes for you. And what
And are you teaching the class? You'll be there?
I do, I
Okay.
do.
All right. Well, yeah. I'm glad we had a chance to meet before the class. That makes me feel a little more like I can maybe go.
Yeah, yeah, and we're adding new people, from time to time, so there'll be I don't know if anybody will be new this month. I'm not sure. There might be another new person in your group. But there'll be other people that have been working on their bullseye plan for a while.
And
So
we spend time in the class. We work on our bullseye together.
yep. In a partnership, you do talk about it. We start out to do a little survey. Dr. Sauerwein will come in for a little while and you have a chance to kind of write down questions for him. If he needs to see you one-on-one, he can pull you out during the class, the second half of the class. But otherwise, you don't see him, but you have a chance to interact. And then you do the bullseye check-in with someone, and then we kind of talk as a group and kind of figure out what the barriers, because there's barriers that come up when we're trying to do some new things. And so we learn skills for addressing those barriers. And one of those skills is getting really connected with our bullseye. But there are
Mm,
skills, and we have some fun in the class too.
mm, I
We'll
could use some fun.
yeah, good. Yeah, we do this driving the bus exercise at the end, and we sing the happy birthday song, just saying pain at the beginning. We're quite silly, and we don't do much, but it's not all boring kind of stuff. So let's see what you think when you get there.
All right.
All right.
Okay.
Yeah. Last question, scale 1 to 10. Was this visit helpful? 1 not helpful, 10 very.
I'm gonna go with the 10, I was pretty skeptical, but it feels helpful to talk to you about some of my values and make a plan.
Ah, that's so cool. Thank you for that. And I look forward to getting to know you over the months and years. I mean, the class is ongoing.
All right.
And you.
Thank you. Thank you so much.